Hey everyone, Dr. Witt here, and today I'm going to tell you a little bit about lateral epicondylitis. And the reason I'm telling you about lateral epicondylitis is because I developed it this last week. So about a week ago, I was doing yard work for 2 or 3 hours for a pretty long time, not something I generally do. And a couple days later, my elbow started hurting me. So lateral epicondylitis is pain on the outside part of the elbow. So I'm going to show you a test that you can do. Generally, you can kind of diagnose this yourself, but I'm going to show you tests that you can do on yourself, and then I'm also going to show you some of the exercises and some of the ways that I'm helping myself heal from this particular issue. So this right here, we're going to call the modified Cozen test. So the Cozen test is usually done with a practitioner, but you're going to try this one at home. So the first thing you're going to do is set your hand down like this. You're going to turn your wrist inward like this. And what you'll do is you'll grab your hand and then you'll resist against your own hand. Now, if that causes a sharp pain over here in your elbow, that might be an indication that you are dealing with some lateral epicondylitis.
One of the first things that I did was to deal with the soft tissue of the arm. So with the lateral epicondyle, what's happening is we have tendons that attach the muscles of the wrist forearm here. So if we're doing this, those are the muscles that are attaching to that lateral epicondyle. So those tendons are very inflamed. So what we want to do is we want to work with those muscles. So there's lots of different ways we do that. The way I like to do it is using a fascial scraping tool and some sort of topical analgesic. So this is Stop Pain Clinical. A lot of my patients really enjoy this one. It can be a little sticky sometimes when we're using the tool, but overall it has a really great effect on the pain. So it has menthol, which helps to activate nerve receptors to help with pain. And then it also has MSM and glucosamine, which can be helpful for decreasing inflammation. And the issue is we have an itis, an inflammation on the lateral epicondyle. So we want to decrease that inflammation as much as we can. So we want to put a little bit of the Stop Pain on there, and then we just use our tool. Right, so those muscles, right, come down here. So we want to work around that lateral epicondyle. We want to go up and down the arm and just really work in that stop pain. But we also want to put a little bit of pressure to work on those muscles and to work on activating receptors, movement receptors, pressure receptors to help relax those muscles and help decrease that inflammatory response that's happening on that forearm. And the really great thing about stop pain is that after it dries, you can actually put tape over it, and taping for lateral epicondylitis is a really great benefit as well. So I'm going to do that right after I finish here. Alrighty. So that feels pretty good. It's starting to dry up a little bit. So I'm going to go ahead and call that a day. Like I mentioned, the really great thing about Stop Pain Clinical is that once it dries, it's not sticky and it's not oily. So we can actually tape on top of that. So I'm already feeling some of those effects. It's nice and cooling. It's feeling pretty good. So now we're going to do some taping for lateral epicondylitis. So what you'll need is 2 short kinesio tape. I'm a little bit smaller, so I use 2 squares, and then a longer one. So I use 5 squares for that one. So what we're going to do is we're going to put our arm at about, this like little 90-degree angle there, and we're going to basically do an X over the lateral epicondyle for the short ones, and then we're going to take that long one and we're going to come down along the line of those muscles. So what kinesio tape can do is it can help with swelling and inflammation, it can help with blood flow, it can support the muscles, and it can help with pain as well. So what we're going to do is we're going to take this first one, and we're not going to do a super huge amount of stretch on it, maybe with like about 25 to 50% stretch. And we're going to put that over that lateral epicondyle. So with these, the main thing is you want to try your best not to touch the sticky part of the tape at all. So we're going to come here. So the lateral epicondyle is right here. So we're going to come right on top of it. We're going to attach just past it, pull a little bit, and then stick right here. We're going to take our second one. And again, we want to do our best not to touch the sticky part because we want that to stick to our skin. Alrighty, so we're going to get that one there. So we're going to go in an X on that lateral epicondyle, so coming up just like that. So that lateral epicondyle is right there, darn near center, if I do say so myself. All right, so then we take our long one. We're going to fold this back. Again, we want to do our best not to touch the tape, or the sticky part of the tape, I mean. So we're going to put that kind of right on top of that one that was going up the arm. So we're going to stick that down there. Try not to get any wrinkles in it. And then we're just going to kind of pull it and stick it as we go down the arm. So this is one I've done for patients as well. It's easier to see, I'm going to be honest, if I have two different colors, but I only have one color here at my office because it's the color of my business. All right, and then coming down here, doing maybe about a 50 to 75% stretch, coming down and putting it right there. So with Kinesio tape, what you want to do is you actually want to rub it a little bit, warm it up to get that tape nice and sticky, to get the kind of activate the glue. All right. So there we go. So we have the two over the lateral epicondyle, and then we have the other one coming down along the line of those muscles. All right, so now that I'm all taped up, I'm nice and supported with my Kinesio tape. So I'm going to leave this on for probably about 2 to 3 days. Once it starts to peel off, and it's starting to peel off kind of at all the different corners, then I'll use a little bit of coconut oil and rub that on there and just very slowly take it off my skin, making sure I'm not pulling any of my hairs off or anything like that. And now that I'm nice and supported, I can get on with my exercises. Alrighty, now of course, all of those passive things that we do, right? Going to the chiropractor, making sure all the joints in the area are moving well, getting some massaging or doing something with the soft tissues to help those, as well as doing that taping. These are all really great passive modalities, but we have to have an active care portion to our recovery process. And the reason for that is because if we are not using our muscles in their regular motion and activity in certain ways, then it can put us at risk of re-injury later on, at a higher risk of re-injury. And the reason that that happens is because when we get inflammation, so right, let's say this is the lateral epicondyle up here, here's a tendon from one of those muscles that's inflamed, and then that muscle there, right, going down that forearm into the hand. So we have in that tendon, we have inflammation. So as we have inflammation, our body is going to lay down scar tissue. So it starts to lay down all this scar tissue up in that tendon. Now, the issue with that scar tissue is as the body is going through that remodeling process, we actually want to be remodeling that tissue with the lines of the fibers that are in it. So the fibers of that tendon, right, are going to go down like this. So as that scar tissue and as that tissue remodeling process is happening, we want to have that being laid down with those lines and with the fibers in that tendon, because as that process is happening, that's going to put us at a better place to have a stronger remodeling process and a stronger healing process, and helps us decrease the risk of having that continued issue over and over and over again in perpetuity, like many of my patients have had. Now, when it comes to doing the exercises for lateral epicondylitis, there's a couple different phases that we will have. So the first phase, we basically are just doing some general movement of those muscles. And we're using those muscles kind of to the point of strain, but not necessarily putting ourselves into a situation where we're going to cause a flare-up of that inflammation and cause more pain. So the way I like to explain to my patients is think about kind of bending your finger back a little bit. Now, you're going to get to a point where you're like, you know what, if I bend my finger back more, I'm definitely going to be injuring myself. It's going to cause a lot of pain. So we want to, when we do our exercises, we kind of want to bump up right against that strain, that point where if we go a little bit further, then it's probably going to flare us up. So we want to go right up until that point. So in the first phase, we're just really moving around that muscle and using it a little bit. Alrighty, so when it comes to the first phase of our active care for our lateral epicondylitis, we're really not putting a lot of load on it. Now, I'm past this phase already, but we're not really putting a lot of load on those tissues, but we're putting a little bit of load in order to, like I mentioned, remodel that tissue appropriately and effectively. So one of the first exercises that we're going to do is we're really just going to hold. We can get a tennis ball. This is a lacrosse ball. You can get a squash ball as well. And what you're going to do is you're just going to squeeze that ball, again, to your tolerance level, right? We're going to go right up against that strain feeling, and then we're going to let go. And we're basically just going to hold that, kind of pump it a little bit, and let go. Squeeze and hold for a few seconds, and then let go. Generally speaking, I like to give my patients 10 times 3, so 10 repetitions, 3 sets of those repetitions. But it really depends on the person and what they're able to do. Now, the second one we're going to do is we're going to be doing load on these muscles here. So the way that we do that is we let the hand drop. We can sit at a table. We can be at our chiropractic table as well, of course. But we're going to let that arm kind of fall off, let that hand kind of go down, and we're going to lift up the hand and just slowly let it down. So we're doing eccentric loading of those tendons. So we just let that hand go all the way down, bring it up, and then just let it come down again. Now in the very acute phase, so when we first start having this issue, that's going to be a lot for a lot of people. But we're not going to keep it there. We're going to start adding load as time goes on and as we start to remodel those tissues. Now the third thing we're going to do is we're going to stretch that forearm. So we're going to put the arm out like this, and we're just going to bring that hand down and just stretch that forearm out, let it go, and then stretch again. So doing 10, 15, 20, 30-second holds, whichever feels really good for you. You can also kind of twist inward a little bit. That might get a little extra stretch into those tissues. You can stretch outward like this. And like I said, we're just putting a little bit of load on those tissues as that remodeling is starting so that we can get that scar tissue in line with the fibers of those tendons. All right, so for phase 2, one of the exercises that we're going to do is the same as phase 1, but now we're going to add weight to it. Now I have an 8-pound weight right here. I'll generally start my patients at 3 to 5 pounds, depending on what they can kind of put up with, right? Like I mentioned, we want to kind of push against that strain feeling, but not overdo it and re-inflame that area a lot and get that flare up. So again, we're going to hold that dumbbell into our hand. We're going to go off you can sit next to a table. So you're going to, let's say we're letting the wrist hang off the table. We're going to let it go down. We're going to lift it up. So we use our other hand. So we're not actively contracting these muscles to get it up. We're doing eccentric loading. So eccentric means that the muscle is elongating, eccentric elongation, okay? So we're going to hold that up there, and then we're just very slowly going to let that dumbbell bring our wrist back down. We're going to use our other hand to lift it up, and then we're going to very slowly let that dumbbell bring our hand back down. So again, we're going to do, generally speaking, again, I will give my patients 10 repetitions, 3 sets of those 10 repetitions. For the next 2 exercises that we're going to be doing for our lateral epicondylitis, we're
we're going to be working on supination and pronation. Now, supination, the way that I like to remember it is our palm is up like we're holding a bowl of soup. Pronation is our palm down. So palm down pronation, holding a cup of soup, supination, right? So supination, pronation. So what we want to do is we want to wrap around one of our resistance bands. Okay, we're going to wrap around both sides to give ourselves a lot of stretch there, okay? And what we're going to do is we're going to put some tension on the band, and we're just going to pull that band into supination. So just like this, right? Palm down first, and then we're pulling to get our palm upward for that supination. All right, now in order to do pronation, we're basically just going to go opposite. So we're going to bring our hand down like this. We're going to make sure that the band is up top, just like this, because we want to pull against it. And we're going to, again, we're going to pull against that band. So we are now pronating that palm, right? Going palm down for pronation, just like that. And again, we're doing 3 sets of 10 for each of those. And even though we're usually just working with one side for lateral epicondylitis, I like to make sure my patients do things. If we're doing it on one side, we always want to do it on the other side as well, just so that we don't end up with any sort of imbalance in our musculature. The next thing that we're going to want to do is something called radial nerve flossing. So the radial nerve comes down around that lateral epicondyle, and compression of that radial nerve can exacerbate or make worse the issues at that lateral epicondyle. So what we want to do is we want to make sure that nerve is gliding nice and smooth, so that it's not getting irritated and making that pain in our elbow worse. So what we're going to do is we're going to put our affected arm by our side out a little bit, making a fist. We're going to turn that fist toward our body, so it's going to look like a little crook. We're going to bring that arm backwards a little bit, just till you can kind of feel a little bit of a strain. You might feel it right there, okay? And then what we're going to do is at the same time that we are turning our hand inward, so we're going to keep it back, we're going to turn it back toward our body and out, but at the same time we're doing that, we're going to bend our head to the opposite side. So it's going to look like this. I'll show you face on and then to the side as well. So we have our hand back, we have our fist pointing backwards, and then we're going to turn it inward and then back. Turn it inward and back. So what it looks like from the back, right? We have that pointing backwards, and we're going to tilt our head to the side opposite, and then come back, right? Tilt the side opposite, and then come back. So what that's going to do is it's going to help that nerve stay nice and loose in that area, and if it is compressed anywhere, it's going to potentially help decrease the amount of pain that we're having in that lateral epicondyle. Now, of course, the last thing that we're going to do is we're going to stretch our forearms. Just like in phase 1, we're going to continue in phase 2. So we just put our arm out just like this. We're going to put our palm downward like this, and we're just going to press on the top part of our arm to be able to stretch that forearm. So again, it's going to be just like this. We're going to let the hand come down. We're going to press that to get some more stretch in there. And we can even to the side and away. But we're just making sure we're keeping those muscles nice and loose. Alright guys, so hopefully this video has been helpful for you to address that lateral epicondylitis that you've been dealing with. I've been dealing with it. I'm now on, let's see, it started on Wednesday, so we're Wednesday, Thursday, Friday, Saturday, so on day 4. I've already decreased the pain that I've been feeling by at least 50% since Wednesday. It's feeling a lot better. I anticipate within the next week to week and a half, I'm going to be almost back at 100%. Within the next month,
definitely going to be back at 100%. So feel free to like, follow, share. I'm going to keep you updated on how it's going for me. And if you want to get some more information about lateral epicondylitis, then please feel free to give me a call at 510-671-1716. We can set you up with an appointment, get you a plan, and get you back to doing the things that you really enjoy doing. So that's it for me today. Of course, I always love talking with you. This is Dr. Witt, that chiropractor that keeps you moving, and I will talk to you again in the future. Have a great one.